Hello, friends. This is Dr. Krup Pasavada, and our today's topic of discussion is examination of rape accused. So, this is a very important video. If you want more video links, you can visit the description box. And still, you have not subscribed this channel, please subscribe it. Introduction. It is better to examine the accused after the victim and look specifically for any injuries she says she had inflicted. So, जो भी victim ने बोला है कि उन्होंने ये इंजरी इन्फ्लिक्ट की हुई है, ऐसी इंजरी के लिए इट इज बेटर टू एग्जामाइन द एक्यूज्ड आफ्टर द विक्टिम. एक्यूज्ड जो है उनकी जो एग्जामिनेशन है वो विक्टिम के बाद करनी चाहिए. द प्रोसीजर फॉर एग्जामिनिंग द एक्यूज्ड इज सिमिलर टू दैट ऑफ द विक्टिम. सो जो एग्जामिनेशन प्रोसीजर है वो सेम विक्टिम के जैसी है. अगर आपको रेप के रिलेटेड ऑल द वीडियो का लिंक चाहिए तो वो भी हमने डिस्क्रिप्शन बॉक्स में प्रोवाइड किए हुए हैं. Preliminary data, first of all, we look into preliminary data: name, age, occupation, address, brought by whom, the person brought by whom, identification marks, date, place, and time of examination should be noted first. Then, development of genital organs and physical build of the accused is noted. This is very important. Development of genital organs, it is very important. The accused consent is of utmost important and should be respectfully sought. So first of all, it is important to take consent from accused. However, if the accused refuses, the examination and collection of necessary evidences such as blood or swabs may produced under the application of reasonable force. अगर consent नहीं मिलता है, then with reasonable force all the things which is related to examination must be collected. The presence of an attendant is not necessary here, so this is also very important. History of his version of the case is recorded. Mental status and behavior should also be noted, right? So all these things are very important. They are called as preliminary data. Clothes should be examined for tears, loss of buttons, foreign matters, and blood, semen, mud, and cosmetic stains. So this is very important. Clothes should be examined. The examination of clothes is very important in this kind of rape cases, whether it tears, loss of buttons, foreign matter, and all other stains. Right? Marks of injury on the body should be noted, like if it is scratches or any bite marks or any contusions, bruise, fingernails, knees and elbows should be examined for abrasions. The age of the injury should be determined. So if you want age of the injuries, you can visit the playlist of injury and its medico legal importance. Marks of general violence should be noted. If there is any general violence, marks of it should be noted. And nail scraping should be examined for epithelial cells or fibers. So nail scraping is also very important here. Local examination, the first of all, genitals, pubic hair, any foreign hair, matted hair, and female pubic hair to be preserved. His pubic hair is also preserved. So here, if a doctor find any hair, it should be preserved. Either it may be of accused or victim while doing examination of accused. The next one is development of genital organs. With particular reference to the potency, any injury to the genital organs is to be noted. Forceful penetration against the resistance into a hymen may produce tears or bruising on the frenulum of the prefuse in the uncircumcised penis and abrasion of the glands in both the uncircumcised and circumcised penis. So now here, let us understand two different things. So first of all, for uncircumcised penis, there will be a tear or bruising of frenulum of the prefuse if there is resistance, and if it is uncircumcised or circumcised, there will be an abrasion in glans penis also. the existence of venereal disease must be looked for. So this is also very important, whether there is any venereal disease or not. Examination of penis. Now, examination of penis for accused is an important part. The first of all, smegma. So what is smegma? The word smegma here uh, is thick cheesy secretion along with discriminated epithelial cells and smegma bacilli. So if present under the prefuse and corona glandis is inconsistent with recent sexual intercourse. The smegma is rubbed off during intercourse, which takes about 24 hours for redeposition. So, अगर smegma present है under the prefuse and corona glandis, तो वहां पे recent sexual intercourse नहीं हुआ है, because smegma is a lubricant, and if it is rubbed off, because it is rubbed off during intercourse, which takes about 24 hours for redeposition, right? So if smegma is present, then there is no recent sexual intercourse, right? Lugol's iodine test, it is now redundant. So now it is not so a necessary test. Iodine solution painted on the glands would reveal the presence vaginal epithelial cells by turning brown due to glycogen present in them. So in vaginal epithelial cells, there will be a presence of glycogen. So if iodine solution painted on glands penis, they turn brown, right? So this is a Lugol's test. Suspected penis is washed with saline and the material is stained with smear test. That is also called as Papanicolaou's stain. Vaginal and cervical cells and Burr body identification suggest recent intercourse unless the accused has used a condom. So अगर assailant और accused जो है उसने अगर condom use नहीं किया है, then vaginal and cervical cells and Burr body identification, it suggests recent intercourse, right? And last one is DNA test. The vaginal epithelial cells can also be subjected to DNA analysis for the identification of the victim. Now, what are the specimen to be preserved, right? So first of all, clothing, stained, torn, missing button, and foreign matter. Scraping of blood and seminal stains, grouping DNA characteristics. Hair, matted pubic hair, foreign hair, and control hair sample from the scalp. Saliva, secretor status, debris under the nail, blood for grouping, alcohol, drug, VDRL test, ELISA, and for HIV. Here, VDRL is again venereal disease. If sample from both the victim and suspect are packed on the same table or surface, contamination can occur. So this is very important, right? That if both the samples of victim and accused are packed on the same table or surface, contamination can occur. Therefore, care must be taken to prevent accidental contamination of sample. So while packing or collecting samples, care should be taken because there must not be any accidental contamination or to prevent accidental contamination. Thank you for watching this video. You can subscribe this channel, click bell icon and share this video amongst your friends. Thank you.